Americans are increasingly smoking fentanyl, and according to addiction experts, that's probably a good thing. To learn more, stat addiction reporter Lev and I visited a distribution warehouse where millions of glass pipes are shipped to harm reduction organizations across the country.
It's a really simple design. You've got a stem and a well.
Then we trekked deep into the woods of New Hampshire with outreach worker Megan Merrill as she distributed pipes and other harm reduction supplies to a tight-knit unhoused community.
And this is to smoke heroin or, opioids.
So why has smoking fentanyl become more commonplace among users? What makes smoking a healthier alternative? And how are harm reduction organizations helping accelerate this shift from IV use to smoking? All that and more in this week's Status Report.
This is our third unit.
Jim Duffy is the founder of Smokeworks Injection Alternatives, located just south of Boston.
We started as a buyers club organization, meaning we'd reach out to folks who are doing harm reduction, mostly in hostile environments, unfunded, folks who were spending their own money to keep the trunk of their car stocked, who did not and never would have enough supplies. So the buyers club was, oh, are you buying pipes? You're spending too much. Give us the same amount, we're gonna come back with twice as many at a better quality. And that just kind of grew into direct sales because the need was always there. This is where we stock and produce the actual kits that we make. So like 2 different pipe kits, boof kit and a sniff kit. Mostly made in this room, some are outsourced, and then the glass production is mostly down the hall. You can smoke most substances, be it opioids, stimulants, any form, be it powder, tar, pills, crystal, rock. We have 3 different pipes for 3 specific different needs: heroin, crack, and meth. So in these, we'll get some that just don't make the cut. And like, that's a perfectly fine bubble. Okay. But with respect to the fact that, people deserve what they deserve, we're not gonna put out one that's smaller, inferior, oddly shaped.
I'm not seeing anything.
Nothing, just smaller. That's it.
Size,
but like,
okay.
I don't want the person on the left getting the perfect one, person on the right getting a smaller one.
Sure.
There's something in harm reduction where like, we remove expectations like that just because there's no monetary transfer. You wouldn't sell that to someone over the counter. You wouldn't sell me at the same price a fucked up muffin.
Don't give people things you wouldn't sell them.
Yeah, exactly. Yeah. What we do isn't as much to force a shift from injection to smoking, but to support people's preference for smoking over injection. So we're meeting people where they're at by providing the tools they've been asking for. But we're also giving people the option to smoke instead of inject once, sometimes, or permanently. And people kind of come to that on their own.
One benefit of smoking versus injection is that injecting drugs requires much more time and supplies.
So we're talking about an enormous amount of time and space you need. And if you're outdoors, every minute is one that you're subject to theft, arrest, violence. If I can give you a pipe, you can turn a 15-minute risky public injection into a quick hit and keep on moving. If we're looking at smoking dope, opioids, fentanyl specifically, there's 2 specific things that we can offer. And the other side of this is that if I needed to smoke meth right now, I could smoke it out of a tennis shoe. So you can use one of those pipes for this. But ideally, this is the hammer pipe itself. What pipes give you is the opportunity to titrate your use. Instead of taking a full shot of something that you don't know what's in it and it could potentially kill you, try a little bit. It literally insists that you take a breath and take a moment. And my favorite thing about smoking as overdose prevention is that smoking is a social experience. And there's really great qualitative data that shows people like smoking as a social experience as opposed to injecting, which is usually a solo experience, because when do we lose people? We lose people when they're alone, when there's no one to help spot or reverse an overdose. So smoking as a social experience reinforces the safety net.
Jim believes that simply making pipes more readily available was enough to cause many users to switch from much more hazardous IV use to smoking.
People were using syringes because that's all that was offered. the demand for smoking supplies was there, but pipes were never on the table, so we couldn't talk about it, let alone offer it. When we started offering it, we realized that people had preferences we weren't meeting. And like, it wasn't long into pipe distribution at the exchange that we had people putting syringes back in our hands and saying, no, I'll just take the glass, or I'll just take the sniff kit. And like, if that isn't any positive change, what is?
If you're digging this video so far, please like and subscribe. It's a little click, but it helps us out a lot. And Status Report is now on Instagram. You can follow us there at Status Report IG. Okay, so anyway, Lev and I want to see firsthand how harm reduction and outreach organizations were utilizing pipes and other supplies from places like Smokeworks. So we embarked north to the Granite State.
We're spending time with a harm reduction worker named Megan Merrill, who is out in New Hampshire doing mobile outreach. So she is finding people who are often unhoused, maybe living in homeless encampments, and she is distributing safer consumption supplies, sometimes syringes, sometimes pipes, other stuff too, just like hand warmers and socks and condoms. But we're gonna spend some time with her to see how she approaches these conversations about whether people want syringes, whether people want pipes, and whether there are active conversations among people who use drugs about facilitating that switch in the interest of preserving their health.
Most of our participants, when they're looking for places to sleep at night, it's hard. And this place I'm bringing you is one of the places where it's been kind of easy for them to like set up camp and set up their spot. Myself and other community providers are their only lifeline right now.
Megan has witnessed the shift from injecting to smoking firsthand.
I've been sober for 3 years. When I was using 3 years ago, it was mostly injecting. Like everyone was injecting their drugs. You know, you would have people smoking here and there if that's what they did and they weren't people who injected, but now you have people who are actively, people who inject drugs are switching to smoking them and sniffing them. Like we're seeing a lot of like people getting foil and a lot of people getting like the glassware to smoke it. So there's definitely been a big shift in injecting to smoking. The supply sucks. Like the supply is full of tranquilizers and just not good things for their veins, and it's destroying their arms. Especially with xylazine in the supply, you get like really gnarly wounds, like abscesses if you miss, abscesses, bloodborne illnesses. You know, if you're sharing supplies, especially if you're an injector and you're sharing supplies, you know, there's a risk of like hepatitis C, HIV. Yeah, I mean, you're more likely to overdose with injecting drugs. It's like kind of like instant. And I say that because I used to be a IV user, and I have overdosed many times myself. And when I would smoke or sniff my drugs, I don't think I ever overdosed, to be completely honest with you.
Like Jim, Megan believes that harm reduction organizations simply making smoking supplies more readily available is helping people make the switch.
Did you say straight pipe too, Allison? You want a straight pipe?
I think harm reduction is a huge, huge piece into why the shift is happening. I think that because we're here, people are like, we have it, so it's like they're wanting it, and that's why they're doing it. Even the outreach we just did, I gave out more smoking supplies than I did syringes.
Do you need any glassware?
I'm very pro, you know, like do whatever you want with your body, but if I could have it my way, I would actually rather them have them smoke it or sniff it or anything like that. You know, injecting it is just, it does so much to your body, and you are at risk of that higher overdose, so.
Lev and I made one last stop at Mass General to chat with Sarah Wakeman, the hospital's medical director for substance use disorder. We were mostly chatting about a topic for a future story, but while we were there, I asked her for her thoughts on smoking versus injecting fentanyl.
First, it's important to embrace the full spectrum of risk reduction. And, you know, we think about overdose risk, of course, but there's also a lot of other risks that are associated with injection drug use. And so, in my purview in the hospital, like a lot of the reason we see people get admitted is for terrible infections related to injection drug use. So non-healing wounds or, bacterial infections, or of course viral infections like HIV and hepatitis C. And so any route of use that does not involve injecting is going to reduce your risk of all of those medical complications. And so just like everything, there's gradations of risk associated with any behavior. And so from kind of the medical harms, injection use is associated with the most risk, because it's not just overdose, it's all of these other infectious risks. And so certainly using intranasally, smoking, using by other routes orally is going to be a less risky route of use. I think the one interesting thing around smoking with fentanyl in particular, though, is that you can overdose that way. So I think it's a nuanced conversation, because I think what you don't want to send the message is that it's like totally safe, because more people are dying from smoking fentanyl than we used to see as people have shifted over to other routes of use. And I think some of that is people aren't aware of just like how potent fentanyl is even when you're smoking it, and the onset of action is very fast. And so it's not, it is a conversation about risk reduction, and especially all of the wound and injection infection-related risks that are associated with injecting. And also you still have to think about overdose risk and, universal overdose precautions, not using alone, having naloxone around, all of those elements.
To learn more about the increase in smoking versus injecting fentanyl, check out Lev's new story on statnews.com. I'll link to it in the description. And as always, if you enjoyed this video, please like and subscribe. It's a little click, but it helps us out a lot. And we'll be back next week. Same stat time, same stat channel.